All right, welcome back. Yes, indeed, we're turning our attention to health-related matters. And as you've seen there, we've got Idaraobong Ekanem joining us here this morning. She's a health officer for International Federation for Red Cross and Red Crescent Societies. Good morning. Thank you for coming on today.
Good morning. Happy to be here.
Okay, so talking about this Lassa fever, ordinarily many might gloss over this, but we understand that there's over 5,000 cases reported this year in Nigeria, about 27 states thereabout affected. What's going on?
Okay, thank you. So, yeah, it's true that we have over 27 states out of 36 states and the Federal Capital Territory reporting Lassa fever in from January 2024 till date. And like you know, or may be aware, Lassa fever is endemic in the country, meaning it occurs every year since 1969, when it was first discovered in the community of Lassa in Borno State. So it is actually a viral hemorrhagic fever that is caused by multimammate rats, rodents. You know, humans can get infected when they have access to, or when they come in contact with the feces, urine, or body fluid or blood of the rat. And also there is also a possibility of human-to-human transmission when they come in contact with body fluids of infected persons like sputum, blood, seminal fluid, and other mucous fluid, yeah.
But this amount of cases that we're reporting in this country this year leaves one to wonder, are we making any progress whatsoever ever since your attempts to ensure that this is reduced, if not eradicated?
Yes, I think we are making progress, although there is still a lot more to be done, because every outbreak starts and ends in the community. So we need to have more community awareness, community engagement. For this particular outbreak this year, we have seen cases that are coming up from states that were not typically reporting Lassa in the past, and that has caused some concerns. The Nigerian Center for Disease Control, which is the coordinating agency for the Lassa outbreak, is doing a lot and coordinating with other partners, which the Nigerian Red Cross is also among the partners responding to the outbreak. So yes, the government, the Ministry of Health and the NCDC is doing a lot with the partners, but there is still more to be done in several communities, especially at community level.
Which of these states are these?
Where we are working?
These new states that were not reporting the...
Yeah, like Rivers State is reporting this year, Kaduna is reporting, Cross River is reporting, Plateau is reporting, apart from the hotspot states, which are Ondo, Edo, Taraba, Benue, Ebonyi. These are states that are endemic to Lassa. But even in the states that are endemic, we also have LGAs now that were not really affected in the past that have started reporting. And that is the focus of the Nigerian Red Cross this year, because there we believe that there is low awareness, there is late presentation of cases, which is leading to high fatality, high number of deaths. So the Red Cross is leveraging on their presence in the 37 states to conduct that community engagement and awareness, to let people know about the signs, the symptoms, and also promote early presentation at the health facilities for treatment.
It is really sad that every year we have to deal with this Lassa fever. We know that usually this happens mostly during the dry season.
Yes.
We've been told that as a result of practices, you know, people spreading food, this culture of still spreading food on the main road, where, you know, produce is spread out to dry, and, you know, as a result, coming in contact with these rats.
Yeah.
And I think also a very huge concern is the fact that we're also losing health workers.
Yes.
So far, we understand about 32 of them have now died, which is really very, you know, upsetting, so to speak. But I'm wondering, is it that there is no awareness? Because, I mean, you would think that as a result of this happening on a yearly basis, that by now people should know that these practices much as it might seem convenient and people want to make use of the sun, it is not very wise, or neither is it healthy for people to continue to spread food on the road. Why do you think these practices are refusing to die out?
Okay, so apart from people spreading food on the roads, people also use rodents as source of food. So this has also, caused,
like,
yeah, like
eat rats.
Yes.
Oh,
and
Is that the same thing as the bush rat?
Yes, so we don't really differentiate, though it is caused by multi-mammate rats, but when we are creating awareness, we ask people not to even eat rats. So apart from spreading food, and also the rats that infest into the homes and also have access to people's food due to poor sanitation, or they don't put their food in rodent-proof containers and all that. Another outstanding risk factor is the conception, the misconception people have, the belief that people have. Some people feel that Lassa fever is a punishment from the gods. So with our community-based presence, our community...
In this day and age, in Nigeria?
Yes, yes, of course. So they feel that people that fall sick because of the bleeding that happens towards the end of the peak of the disease, which also leads to death. So people feel it's a punishment from the gods or something. So we try as much as possible to continuously engage them and sensitize them to stop eating rats, to stop spreading food on the roadsides, to maintain personal hygiene. Yeah. And
how a priority would you say this has been for the governments in the state where have been perennially affected? Yes, you have mentioned that a few states have just recently joined the list that we did not used to see before now. But for the states that this is a problem for them, year in, year out, they're always reporting these cases. Would you say that we've seen an increase in their own attempts at creating awareness, level of awareness amongst their own populace, especially when the dry season is approaching?
Yes, I would say that if you look at the statistics for this year, the states that are constantly reporting that are endemic to Lassa fever have actually reported low number of deaths. So it means that the government and the partners are doing a lot to let them know about the disease and also to promote early diagnosis and referral because it is treatable. So what leads to the high number of deaths is when people don't access healthcare on time. So yes, a lot is being done, but we still need to do more because behavioral change takes time, So we need to continually sensitize the communities using multiple channels to communicate, engaging key influencers, and that is what the Red Cross is doing currently. Risk communication, targeting opinion leaders, community leaders. We not just to, for instance, now, the NCDC has set up the Emergency Operations Center in the country and also cascaded it to the state level. But we need to also do same at community level, at local government level, where these cases are coming from.
And what has the response been like with the local government officials? And we know how things can be at the local governments, but are there local governments that you have worked with that you would say, oh, these local governments are worthy of emulation? You wish that other local governments were like this?
Yes, there are local governments that, of course, it's a public health issue. So all hands are on deck to ensure that we contain the outbreak. So the local government officials, the state epidemiologists, the disease surveillance officers are very cooperative in investigating, although there have been panic based on the number of health workers that have been affected. So it has led to refusal or rejection of cases. But the government at all levels are also working to provide psychosocial support in collaboration with the Red Cross to the health officers and also provide personal protective equipment, to them to mitigate the risk. So there is a big, there is a strong political will from the local government,
So it's when you say bush rat? Is that another name for bushmeat? Is it the same thing?
The different types of bushmeat, Chamberlain.
Okay, because people need to know what's really going on here so that they get it right. But I also see in some of the narrative that you talk about, some of the literature say health workers are rejecting symptoms, and so that is why it's important to talk about it. Can you shed some light on that? Is that actually happening, where they deny the symptoms? Or what is that story about?
Okay, so we call it health worker apprehension, based on the number of health workers that have been infected, about 32 so far. So some health workers, when they see cases that present the community definition of Lassa, symptoms of Lassa, they tend to, because of that fear. So what we are doing is to encourage them, to sensitize them, to also create an enabling environment for them to be able to function with minimal risk. And this includes providing them with the basic protective equipment that they require.
So in terms of what needs to be done on the part of the individual, do you think that at least, other than government putting out these messages, are people getting the message such that you see, are they taking the right measures to ensure this doesn't spread any further?
Yes, at community level, yes, because this is an individual thing. It's an individual infection. So people are taking up, people that have been sensitized, that are aware, though the challenge we have is the low awareness, especially in areas that the disease is new to them. But people are beginning to take, we have seen people demonstrate good hygiene practices, people packing their foods properly. In markets, we have sensitized women and men to stop spreading food. So in areas that they are affected and we are present, and of course other partners, yes, we are seeing behavioral change.
What alternatives are they using in these instances? Because what they're trying to make use of is the sun. It's not like as if they, really want to spread the food on the road. You just want to be able to make use of nature's gifts. So what alternatives did you have to provide alternatives to them, or you just had to say, no, this has to stop, and then they found the alternatives themselves?
So one of the alternatives we have, one of the measures we have put in place is to distribute rat traps for them to be able to, place in their homes, and also sensitize them on guiding when they are spraying. Most times the practice is to spray on the road and just leave it, so they stay and guide their food items, because really you can't really stop them from making use of the sun, which is like the cost-effective means of drying their grains. So we ask them to have those protective, and then don't dry it on the sand also. So they lay on material, a clean material. And that's part of the hygiene promotion activities we are doing in the States.
All right, just
to do. But if, you could get through to, you've already said that NCDC is doing quite a bit on that front. But what more support would you think that, actors at the federal level should, be making, especially in the area of health, with regards to diseases that are generally endemic, not just Lassa fever? Well, maybe you could start with the example of Lassa fever.
Yeah, I think that we need more actors, we need more partners to bring in resources and targeting communities.
Are you talking about donors?
More present, yeah, partners, donors, and even the government also, to support the government to target the communities, to have more grassroots interventions, because these issues are happening at the grassroots. And also to pay attention in terms of early warning signs. We already have the seasonal calendars that we know that in dry seasons we have the Lassa fever. The rains have started, so we are expecting cholera. So we need that strong early warning system in place to prep the community, to prepare them for response. And this can only happen when the community is involved in the plan, they participate in the approach for the early warning.
Could you go over those early warning signs again, those symptoms, so people can look out for them when they see them?
Okay, in respect to Lassa fever, so it starts between, symptoms start showing between 3 to 21 days of infection, and symptoms include fever, body pains, vomiting, diarrhea, general muscle pains, and bleeding in natural openings of the body from the eyes.
Is that for the first 21 days?
Yes.
Wow.
So, yeah, it's an acute infection. So between 3 to 21 days, one starts showing the symptoms. Then when it picks up, it's when the people start bleeding. And that's when it becomes very serious and leads to death.
But do you get, I imagine that there'll be cases wherein if it's fever, they say, no, don't worry, they'll treat themselves at home. And then before you know what's happening, it snowballs into that. Or are there cases where the first 21 days, you don't see any bleeding until much later?
Yes, there are lots of cases like that. In fact, the reason we are having high number of deaths is because when it starts like fever, like I mentioned earlier, we have the late presentation of cases. So people start self-medication, yeah, and then present themselves to the health facility when it's late. So we always encourage, and we are still encouraging Nigerians living in endemic areas and people that have had contact with infected persons to report to the hospital, to the nearest health facilities for diagnosis, for assessment. Yeah.